Where is the beef in so-called personalized health insurance? Well, let's talk about it. Let's see where is the crux of this whole so-called personalized health insurance. How would a personalized health insurance will help you and your family? First, you are a unique individual with different needs during changing times of your life. Second, your family's medical concerns will change from you being married to having children to becoming an empty nesters. So you go through all these phases of life. Most importantly, at all stages of life, personalized health insurance will cover any and all pre-existing conditions, folks. Any and all pre-existing conditions. You're probably anxious to know the specifics, how this personalized health insurance works. Let's get into the nitty-gritty. If you're an individual applying for insurance under the personalized health insurance, you're guaranteed for the policy of your choice in 1 in 4 ways, folks. 1 in 4 ways. You're guaranteed. First, acceptance by a participating insurer. That's number one. Second, acceptance with certificate of guaranteed coverage. And third, acceptance into a premium subsidized health insurance exchange. Fourth, acceptance into a premium subsidized impaired health support group. So these are the 4 groups, folks. Let's go into detail how this will work. If you want health insurance, you will get health insurance into one of these 4 options, folks. No ifs or buts. Anybody can get health insurance, one of these 4 options. What are they? Let's look into it. Consider buying an individual policy. Which option applies to you and your family? At the same time, consider a neighbor situation. Now think of someone else having a high blood pressure, congestive heart failure, and paralysis, and how they can get insurance. So let's look into the detail. It's you and your neighbor with multiple problems. So we're going to address both. Let's walk through the steps and look at the following diagram, folks. It will make it a lot easier for you. Number one, if you apply for insurance and accepted by a participating insurer, so 80 to 89% of them come into the category of 1. They will get insurance and they're accepted by the insurance companies. And in this segment, there are no federal or state subsidies, folks. You are on your own, and basically you're paying for premium, and there's no state or federal subsidies in this category. Suppose if insurer rejects you, you fall into the category of number 2. If insurers reject you, so-called Health Review Authority under the public-private partnership will review your application, and they will look at it and they will provide you a certificate of guaranteed coverage after review. So you fall into that category of number two. So underwriters look at your applications and they rule. Health Review Authority is the is plays a key role in this. So they rule that you will have a certificate of guaranteed coverage, and there are no state or federal subsidies in this group either. So these are the folks, they were rejected by the insurance companies to begin with because of the whatever the reason may be. So number two is taken care of by giving them certificate of guaranteed, but there are no federal or state subsidies, folks. When Health Review Authority looks at your application and it looks at that you need some economic assistance, or if you have a pre-existing illness, then you need help. You fall into the category of three. Number three. What happens? In number three, there's a state exchange with federal subsidies for low income families, individuals and families. You fall into the number three category. There are federal subsidies in this, folks, and you will be given a certificate of guaranteed coverage with federal subsidies. In number three, only federal subsidies only. If you're truly uninsurable, and you're basically being accepted into a subsidized impaired health support coverage, so called, you fall into the category of number four. Number four, you are uninsurable and you're accepted into the subsidized impaired health support group by state and federal subsidies. This diagram is clearly addresses that. So what percentage of them are truly uninsurable, folks? You'll be surprised. 2 to 3% of the entire population. You're talking about 2 to 3% of them are truly uninsurable. You mean to say we cannot take care of these folks with state and federal subsidies? It can be. And even in this category, consumers are in the front line, folks, and you are guaranteed personal health coverage. Guaranteed personal health coverage in this category, which are only 2 to 3. So they are truly impaired, either economic or physical or disabled, pre-existing chronic illness. When they fall into the category, you are truly uninsurable. You come into, and people who didn't buy the health insurance to begin with voluntarily, they fall into this group because their premiums will be a lot higher for those folks. If they didn't buy the insurance for whatever the reason, they choose not to buy, they will fall into that because they'll not only lose tax exemptions, family exemptions from their filings, they will be categorized as impaired support. So their premiums will be a lot higher. So it just doesn't pay. If you don't buy the insurance, there are consequences, folks. There are consequences. So this diagram clearly states, so 80 to 89% of the fall in number one, and only 2 to 3% fall into uninsurable group. That's where we need federal and state subsidies, folks. Let's look in further. Let's look in further. In number one, as I mentioned to you, majority of the folks fall into the 80 to 89% are surely truly insurable, and they're accepted by the health insurance companies, and health insurance companies will take care of their premiums will be lower, not only the lower, and they should be affordable for number one category, folks. These are the people, they are accepted by the health insurance companies. So we don't need to worry about those folks who are healthy or insurable. And number two category, when health insurance, personalized health insurance, anyone rejected by the insurance company will be reviewed by the Health Review Authority. This is where the Health Review Authority plays a key role, folks. Insurance companies rejected it. Then Health Review Authority gets the application. The Health Review Authority will overrule the insurance company. Overrule the insurance company. And applicant will be granted a certificate of guaranteed coverage by the Health Review Authority. That certificate must be honored by the participating insurance company or insurer. It guarantees affordable health insurance with protection for pre-existing conditions, which are roughly around 8 to 9% of the applicant, folks. They're not many. Only 8 to 9% of the applications with a pre-existing condition, Health Review Authority will overrule the insurer, and they will give the certificate of guaranteed coverage, and they take it to the insurance companies. They will get the insurance, and the insurance premium cannot be more than standard premium. Maximum, it cannot be more than 8 to 10% of the people who are paying the premium. It should not be more than that. So they have to respect, insurance companies have to respect the authority of the Health Review Board, because insurers will oblige Health Review Authority rules and regulations, and their participating insurers, they are privileged to get most of the members into their insurance company enrollment. By participating, these insurance companies will have a benefit by participating in the along with the Health Review Board. People in number three, what happens is, in number three category, Health Review Board determines the applicants require some financial assistance. Yes. They look at the applicant and it requires some financial assistance, and she will be referred to a subsidized state insurance exchange. Subsidized, this is a federal subsidy, folks, so they will qualify for federal subsidy. So it guarantees the health insurance coverage under the so-called financial assistance through a federal subsidy program. So states are not burdened with this number three category. The last but not the least, this is the most important category where federal and state, they are number four. If person is truly uninsurable, this is where state and federal subsidies kicks in. Health Review Authority determines the applicant is uninsurable, but they will be given certificate of guaranteed coverage under the subsidized impaired health support plan. When you look at it, there are only 2 to 3% of the applicants, folks. They're not only two. This is where federal and state has to work together to provide the insurance. And once they give the certificate of guaranteed coverage by the Health Review Authority, this impaired health support group will be paying the payments to the insurers so that insurance companies are no longer responsible for the care, and they will be guaranteed by the federal and state subsidies. This is how you get a personalized health care for most vulnerable people. That's what we need. We are talking about 2 to 3%. You mean to say we cannot handle 2 to 3% of the applicants who are really uninsurable? And we're also addressing the concerns of people, in 2000, when Obamacare kicked in, we had 27 million uninsured. That's how we got the Obamacare in the first place. But people, they choose not to buy health insurance voluntarily because there's no mandate, folks. There's no mandate. If you truly choose not to buy, there are consequences, folks. There are consequences because individual and a family will lose tax exemptions, number one. Not only lose tax exemptions, when they get sick, when they are provided health care at a later stage, their premiums are going to be higher. So there are consequences for not getting health insurance when you're healthy. But when you get a health insurance when you're sick, your premiums are not only higher and you'll be penalized for not having had. So you'll be categorized as, when you don't have an insurance, you'll be categorized as an impaired health applicant, even though you're healthy, you have all the um, bells and whistles, but you will be categorized and your premiums will be higher than on because there was a history of not having health insurance in the past. Folks, I keep talking about this personalized health insurance. This will work and it doesn't cost the government a penny. It is federal, you're talking about federal and state subsidies will kick in. Only you're talking about 2 to 3% of the population, which we're already providing the care anyway under the Medicaid. But under this scenario, your focus is more under the personalized, and consumer has a choice where to go, whom to see, which hospital to go. They have a choice. And consumers, so-called, even for these people, this 2 to 3% of the impaired health support group, they will get the personalized care, which is going to be a lot better with technology. With technology is on the side of the consumer, folks. Technology will not only improve and also monitor these folks closely and provide the best care. They don't have to be waiting in line in the medical office. They shouldn't be waiting in line in the emergency rooms. They shouldn't be waiting anywhere. They should get the care, healthcare, right to the door, like what we get in other industries, like in the groceries being delivered to the front door. We want the healthcare right knocking on your door, providing the care. That's what I'd like to see that happen. This is what is called personalized healthcare for all Americans, folks, all Americans. I'll keep I'll keep talking about personalized healthcare till we achieve it, folks. I think technology is on the consumer side. There's no way you can ignore consumer-driven healthcare, customer-driven healthcare, demand-driven healthcare. You name it, folks. It is on the consumer side, and everybody should have personal health care accounts. Even for the sickest, we need to have personal care accounts. And these folks need to be incentivized so they take care of themselves. If they're incentivized, the cost of the care will go down. Healthcare cost, as we see, so-called surprise medical billing, these medical billing, DRG codes, CPT codes, they're the things of the past, folks. Those numbers are made up numbers. They're not true consumer demands. If the prices are transparent, automatically prices will go down in healthcare. Let consumer decide what he wants. That way, you will see that demand control healthcare will bring the prices down, like what we have seen in other sectors, retail sector, you name it, groceries, food chains. Healthcare is no different, folks. I don't know why we have to make it. I understand, the government's responsibility is to give the tools. Let consumers decide what they want. Let folks decide. Americans are smart enough to take care of their own health. You need to give them incentives to take care of their health. Well, that's it for today, folks. Thank you for listening. Thank you for listening. I'll We'll see you in the next episode of Personalized Healthcare. This is Consumers Doctor on the behalf of Foremost Organization. Thank you, goodbye, and salute.